Dr. Tiffany Saucer is revolutionizing mental health care for individuals with intellectual and developmental disabilities. As the Director of Behavioral Health at Achievable Health, she has spearheaded the creation of tailored mental health services that address long-standing gaps in support for vulnerable populations. Inspired by her personal experiences growing up in South Central Los Angeles with her beloved aunt, Dr. Saucer's work dismantles systemic inequalities and paves the way for a more inclusive, compassionate healthcare system.
Thank you so much, Dr. Tiffany Saucer, for joining me here on AwareNow to share this space and to share your story. Thank you.
My pleasure. And thank you for having me.
Of course.
And thinking enough of my story to want to know more. I think that's, I don't know. That's sort of the best pat on the back that I think one can get in work that kind of feels thankless sometimes, or I won't say thankless totally, but the thank yous come in a delay for I need rapid fire. Thank you, right? To just know that I'm doing the right thing or I'm doing something to make change. And so sometimes it's not, there are hard days, long weeks in this work. It's definitely a climb. And so I'm so honored that there's interest, right? And that this can go out and so more people can be aware now. See what I did?
Indeed. I saw what you did there and I heard it and it was fantastic. Well, let's get started now with this question then to start us off in our conversation. So growing up close with your aunt who has cerebral palsy and intellectual disabilities, clearly that had a profound influence on your journey.
Yeah.
So Dr. Tiffany Saucer, can you share how those early experiences shaped your vision and passion for the work you do today, especially in the context of advocating for marginalized communities?
Yeah, I would add a little bit there to just kind of, expand a bit more on that. So I grew up in South Central Los Angeles, and I think that's pretty important to kind of note because limited resources, unfortunately, even still, right? And I drive over there today to visit family, and it doesn't look a whole lot different. Unfortunately, we had the LA riots, right after the Rodney King sort of tragedy and the civil unrest, and a lot of that, since that was in the 90s, a lot of that stuff hasn't been rebuilt. So I remember it burning down, right, in the civil unrest as a child, looting and just conflict, right? And to see now as a fully grown up woman that, there wasn't really a fix to some of these things. The reason why I think that's important is because it's the backdrop of my family story. And so my aunt has cerebral palsy, which is profound intellectual disability. So she operates at about between 3 and 5 developmentally, chronologically, if you will. And she also has seizure disorder. So my early memory was being a kid. She's 8 years older than me. So I can remember coming home from school and, there being this sort of air in the house, in my grandmother's house, because folks my aunts and uncles and my mom were responding to this violent seizure that my aunt had. And so that's important to kind of say, because that is actually what led to the decision that someone has to be with her. It's not, the seizures are, she wasn't walking at that time, I think. And then her speech is not, right? It's not easily understood by folks who don't know her. She actually has made really great gains, she just from the family sort of surrounding her. So she speaks, right, in sentences and things, but it has to be probed. And so, someone like that going to school or sort of integrating into public systems, I empathize with my grandmother. I can only imagine, how you could feel just really uneasy sending your child who can't tell you how the day went, right? And knowing that they have this medical condition and developmental disability that can take a turn at any time without an antecedent, without a trigger. And so that's what I remember. I remember, like, it's sometimes hard to describe in words, but what I would say as a therapist now, and who has sort of explored some of this, is like it was a traumatic experience as a child. Just I felt that in my body, like something's not right, and something bad could happen if we don't sort of do something about it and rally around my aunt as a family. So I'm really good at taking tangents and maybe not answering the question, so hopefully I did. But that's what I remember early on. I think that's what you asked.
And what a powerful memory. I mean, how could that not shape your journey and your direction and your way forward? So in things that I've read, you've described a pivotal moment when your grandmother had to leave her job to care for your aunt.
Yeah.
And that, only highlights systemic gaps in support. So how did witnessing your family's struggle inform your understanding of these barriers faced by your family and loved ones who have IDD? Like, how do you address, I guess the question is, how do you address these barriers at Achievable Health?
Yeah, what I wish I could report, what the mission is that I could report something different, like that this doesn't still happen. But I was actually on the phone last night. I didn't leave the office until pretty late because I was talking to a mother who is at a crossroads in her child's care, her adult child's care, and it's a very similar situation. Like, she made the very tough decision to sort of leave the workforce and take care of her child. And now her adult child is bigger than her, stronger. So it's a little bit more difficult for her to redirect in any way when there's behavior presentation. And so we're at another crossroads in care where, is the home environment the best environment, or should we be looking at some 24-hour supports and maybe like a group home setting or adult home setting? But there's a financial barrier because when you quit your job, you quit the workforce, you become heavily reliant on government support. And, not to get super political, but there are drastic changes with administrations where folks have different opinions on how things should go. And so it's not only just a vulnerability, but you kind of become like at the mercy of, decision makers. And how it drives my work is like, I really, really want to be a voice for that type of situation. Like, how do we capture that narrative and like blow it up on a billboard? Like, can we scream from the mountaintops? Like, what about these people who have already sacrificed so much? It's already difficult enough. I can only imagine, like, if someone told me I needed to quit my job tomorrow, I'm not sure how I would take that. Certainly for my child who's vulnerable, I mean, there's nothing he wouldn't do. So, and then there's this grief process at pretty much every single stage of development that families go through and that parents go through when their child is not hitting those milestones that when, like, let's say for a mother, she was carrying that child, she had dreams and hope, and they're here, they're generally healthy, right? So they're not like on life support or anything, but they're not going to prom. They're not getting that first job. They're not learning how to drive. They're not graduating from college. So in my opinion, it's like, it's already hard enough. So that is my mission. I am not going to exclaim that I'm an expert in how this should go. But I definitely think it's worth a conversation on high levels, on macro levels, on micro levels. Like, if we can raise awareness about it, like this is what folks' experiences are. And to be a voice for like these stories that just are often untold and so therefore just forgotten about, right? And certainly the patients that I serve they can't speak for themselves. And so that's what that's sort of the underlining thing of what I do at Achievable. It's just really, I want to talk about it. I want to strategize. There's not going to be a one size fits all. And I think that's why folks maybe shy away from this conversation, because it is not an easy fix. And that's not lost on me. I've experienced it firsthand and professionally. So I know it's not like what would work for my aunt may not work for another family. I get that totally. But that doesn't mean that we shouldn't be having these conversations and strategizing and doing our best to find solutions, for each individual family in their individual circumstance.
Absolutely. Well, and so more about Achievable Health, it's become a model for integrating mental health care with primary services for people with people with IDD. So next question is, what unique challenges have you faced in expanding these services, and how have those experiences reinforced or shifted your approach as a leader and as a clinician?
Yeah, a very good question. So let me think, how can I tackle this best? I went to formal school, right, for social work. I got my master's in social work. I have a doctorate in social work. Before that, I got a bachelor's of arts degree. I've always wanted to work with this population. I would say that it's sort of a job that kind of found me. I kept getting tugged back to it, right? I remember being an undergrad, and I got this wonderful internship opportunity. And I'll be honest with you, the pay was great. I was a starving student, and I was like, oh, this makes sense. I can like put gas in my car, if I take this position. But it was working with children who had autism. So doing school shadowing and going into their home. And that wasn't uncomfortable for me because I, been around my aunt and been around folks who have unique abilities. I don't really like to call it like differences or challenges. Unique abilities, right? And being in position where I needed to kind of find those strengths to sort of work with this person. And so, but there was no formal training, if you will. Like I never really saw it in like a textbook, right? Like I can think about some of my like practicum classes where we're going through the DSM. When I was in school was the DSM-4. So, there's been a couple of iterations since then. But, we weren't classically trained on what happens when you come across a patient or client who like is on the autism spectrum and also has depression, anxiety, because they're people and they're going through life trauma even. Like, where should you start as a clinician? What are the things to consider? What's the priority list? I didn't get that formal training. And so that's also where I'm starting with Achievable, and why I was so excited, about the position, to be able to just sort of strategize. I really would like for there to be social workers, for there to be psychologists, for there to be clinicians who at least know where to start with this population, right? So again, I'm shooting for the moon, and I'm happy to land amongst the stars. Like I'm really not trying to, save the world in one big swoop, but I think it's a really good place to start. Like if we could just raise our level of comfort, raise our level of knowledge with direct interaction. If you could like do that in a safe space, like at Achievable, where you could have like your practicum or residency, and you're around physicians who are comfortable working with the population. You're around like medical assistants who like know that little thing to do to like get that patient to like have their blood drawn. And like you can witness that and be amongst that synergy. If you can work with an LCSW and a department director who's like, I'm behind you 100%. I know you didn't read it in a textbook. There's not like a theoretical framework that like works perfectly with this population. I know that, but let's try this adaptation and that adaptation. Let's like, what if we consider this? What if we break it down into smaller steps? The average time span, I would say, that I spend as a clinician in mental health services, so like direct psychotherapy, is a lot longer than what like a traditional DMH kind of protocol would call for. It can take me like 10, 15 sessions to build rapport with like Johnny, who has autism, who has never come to therapy before. But, you know, mom is reporting that he definitely has depression. He used to be bright and sunny and happy. And now like it's really difficult for him to get out of bed and he cries all the time. And he can't really tell us like, oh, this happened, or I'm being bullied at school, or whatever the case is. So it takes me time to build that rapport, to be a trusted person in their circle. And then I can begin to sort of strategize about what intervention looks like. And so that's kind of what we do. Not kind of, that is what we do at Achievable in the behavioral health department. We have partnerships with local universities where we are providing practicum. And again, even if some of the practicum students that are with us don't choose like that this is their path and this is their passion, that's fine. But at least I know that there's another clinician out there post-graduation that if someone with autism or intellectual disability comes across their desk and is assigned on their caseload, they're not going to shy away and say that they don't know what to do. They're going to know where to start. They're going to know really well where to start, who to call, what type of information that they should get to sort of support this individual. And that, you know, is when I put my head on the pillow at night, like that's what I'm most proud of.
Well, it's something to be very proud of, for sure. You know, so let's talk about the fact that there is a severe lack of trained clinicians working with this population specifically who have, you know, these disabilities. And so you've committed to changing that by embedding training opportunities at Achievable Health. What keeps you inspired and hopeful in this, what is an uphill battle, to transform how mental health professionals are educated about and engage with the population? Like, what does that hope look like for you?
You know, it's the little moments. It's the little moments where I use the example of, you know, someone getting their blood drawn, right? Really difficult for a physician to like say for certain or have a level of certainty about what's going on with the person if they can't like run labs. Mm-hmm. And so when it is, you know, and sometimes it's a fight for like needle sensitivity, it's really about the trust. Like folks who have, you know, neurodivergence or just have different levels of sensitivity with how they engage with the world around them. I imagine that it's scary for them. Like it's not, and so that's sort of my mindset. Like, even if the person is displaying like aggression, but let's think about this. Like, why would you feel like you need to get combative with someone? Because you're afraid. Yeah. You know, so how do we sort of tackle that and sort of bring that in? And so when I hear that someone who was really challenged with like getting their blood drawn, when I hear about the moment where it actually happened, sure, maybe it took the physician being in the room, you know, parents being in the room, their favorite medical assistant was there. We had balloons, we had stickers, we had music, we had light, strobe light, whatever we had to do to kind of get this done. But that the blood was drawn, it's sent over to a lab, and now the physician can make an informed decision about like diabetes or cholesterol or something that is, you know, really needs to be handled for like a health and safety type of reason. Those are the moments that I live for. When I hear a clinician or a practicum student tell me, this is not that scary, this is not that hard, I just have to tweak, you know, my approach. I just have to take my time. I just have to listen. I heard that from my practicum student Wednesday. We had supervision and she said, can I be honest? Like I was really nervous about, she's been with us since August, late August. So it's been a short amount of time so far. And she's like, I just wasn't sure, you know, how I was going to do. And I really was committed to doing a good job as a therapist for this population. and didn't really know where to start. And I said, that's okay. I didn't either. There's not a textbook. There's not a training module that I can kind of send you that's sort of a one size fits all. But your commitment to wanting to know was the biggest piece. And now she's great rapport with her clients. They're doing some great work. They enjoy coming to see her. So those are the moments that give me hope when I hear that something good is happening and coming of this. I wish it was, on a larger platform, and we'll get there, I think, right? I wish I had, a training cohort of, 25 a quarter where I was just sort of working with clinicians and then, sending them off into the world and saying like, hey, you have this curriculum or you have this model, you have somewhere to start. But I think in due time, I think we'll get there. And I think it will be, again, building that level of comfort, building that level of competence. And I just think it will lead to just better outcomes all around for this population and my family. And for people like me who have an aunt who really needs to know that there are folks out there that care about, our family's experience so far. And so when they meet my aunt, like, I hope that she gets the tender love and care, or that level of compassion that we've as a family already been through a whole lot before we came to your office today, or before, we got on the phone with you today. And so if there can be that compassion and empathy to just sort of consider that, I also think that that's a huge win.
The work that you're doing and the passion, I mean, just in this conversation, you can feel it, you can sense it. We need more like you, because, there is such a need. So may I just say thank you so much for the work that you're doing, for what you're doing, for how and for the why of it. Thank you for taking this time and sharing your story today. And thank you for helping all of us become a bit more aware now. You see what I did there?
I saw it.
Such a pleasure. Such a pleasure.